we're talking about OCD, that's obsessive compulsive disorder. And one of the things we said is that, while we're reading out the facts, is that the OCD starts when in the teenage years, as it were. And we also stated that it has often gone undiagnosed, or let me say underdiagnosed in Nigeria.
Yeah.
And Nigerians are the ones that will just come up and say, well, I think I have OCD, probably because they see some things in their behaviors. And just before we came back, Ombalade and I were talking about how it is actually necessary, even as adults, to go and get tested.
Yeah.
Just check if you have any mental disorder. Don't just wing it and think that, oh, I've been like this since forever. And so this morning, of course, we are not going to be talking about OCD alone, because we have a guest that will be joining us over the phone this morning to talk about obsessive compulsive disorder.
Yes, our guest this morning is Dr. Olabode Olufunke. Dr. Olabode Olufunke graduated from medical school in 2005 and became a consultant family physician and is currently working in Lagos State General Hospital. Dr. Olabode Olufunke will be having that conversation on obsessive compulsive disorder this morning. Nice to have you on the show this morning. How are you doing?
I'm doing great. I'm glad to be here. Thanks for having me.
Thank you for joining us. Our conversation this morning is on OCD, obsessive compulsive disorder. What does it mean?
Okay, OCD, like you said, and like the name reflects, is characterized by obsession and compulsion. So what do I mean by obsession? Individuals or people who have this condition, they have this persistent and recurrent thought strategy to carry out something. So, for example, someone can just feel compelled or keep thinking that his or her hands are dirty, or my surfaces are always dirty. I have to keep cleaning. So, maybe I should start by saying it's a mental illness, and it's an anxiety problem. It's an anxiety disorder. So, and it's characterized by this intrusive and destructive thought or urge to do something. And in order to repress or to suppress this anxiety, they now carry out either physically or mentally those activities. And they find it very distressing. So, for example, someone can think that, oh, my door is not locked. And the person keeps going to check if the door is locked. And the person can go back in, sit down, and get up again to check again. So it's an anxiety disorder that distresses the patient a lot.
Interesting. Does that account for those of us that go back to check if we locked our doors after we've left the house?
Well, we all do. But when it becomes a problem, when it starts affecting your functioning, then it becomes a problem. When you find it difficult to go out because you feel unsafe, it becomes a problem. We all have our obsessions, but you don't do it all the time. You don't do it like you keep doing it and you get this to work.
Okay.
You understand?
Yes.
That's when it becomes a problem.
Okay. All right. So I want to know how easy is it to diagnose or identify OCD? Because I was telling Omobolade just before you joined us that a lot of people have OCD and they don't know because they feel like, oh, I've always been like this, especially Nigerians, as it were. So how easy is it to identify or diagnose OCD?
Okay, diagnosis is basically clinical. And what I mean by that is that you take a history from the patient.
Okay.
And like I said, when someone has, like we all have our obsessions, but when it now brings you a lot of distress, you don't want to do it, or you are compelled to do it, then it becomes a problem. So when you go to see a physician and you give this history, I can, of course, I check if my gas cooker is turned off before I go to bed every night.
Mm-hmm.
But once I check it once or twice, I'm okay, then I go to sleep. But if I go to bed and in a few minutes, I get up again, I'm worried that it's still on, and I go back again, I check, then it disturbs me. So when it becomes disturbing, when it impairs your functioning, then you should seek treatment. So it is easy to diagnose, but most of the time, like you said, we just feel, oh, it's normal, that's how I've been. But no, that's not how you should be. If it becomes a burden doing all these things, then you should seek care. And when you go to see a doctor, maybe a primary care physician or a psychiatrist, they'll be able to diagnose it and give appropriate treatment for it.
So, is there a root cause for OCD? While we were checking through the facts that we saw on OCD, we saw that it manifests sometimes in teenagers, and then it takes a long time before some adults find out that they have OCD. But what exactly causes it?
Okay, the exact cause is not known. But yes, but studies have shown that one, it can run in families. And studies have also shown that identical twins usually have it. So if one has it, the other is likely to have it.
Interesting.
Then there are also some chemicals that are secreted in the brain. We call them neurotransmitters, like serotonin, dopamine. When there's a problem with the transmission of these chemicals, then one can develop OCD.
Okay.
So it has to do with functions of the brain, but the exact cause is not known. So when patients who present with it, when you give them medication, when you do some psychological treatment, or you give medication to enhance this chemical and these neurotransmitters, they get better.
Okay.
So the exact cause is not known, but those are the factors that have been implicated in the etiology or the cause of OCD.
So is that to say that there are no environmental factors, such as maybe divorce, maybe parents are divorced and then the teenagers start feeling like maybe if they do something more, it will make their parents come back together or something. Are there other environmental factors that could be implicated in this?
Well, some other things, but which have not been established as causes. Some feel that parenting style can have some influence on development of OCD in children, which is not really true. So parenting style does not really cause the development of OCD in the children. Or some feel that stress can worsen the symptoms, but it has not been established as a cause.
Okay.
Exactly. Yes.
All right. Do we have different spectrums of OCDs, or there is just one type? I mean, there's a popular one that, the moment you have this obsession when it has to do with cleaning or making sure that you don't have germs around you and all of that, then, of course, everyone would just assume that you have OCD. But there are other things.
Sorry, I didn't quite get that. But if what you are asking is the different types of OCD, is that right? Okay, well, there are categories. You won't really say there are different types of OCD. One can have a particular obsession and the action you carry out, which is the compulsion. So there are some common forms or categories of OCD. For example, the common ones are when you have this fear of contamination, that's the obsession. So you always feel that your house must be sparkling clean or sparkling white, and you keep washing and cleaning, or you keep washing your hands, you always feel that, oh, my hands must be clean, and you keep washing. Or need for order, that's another category. You always feel that, oh, my chair must be in this place, my table must be like this one must be straight, and you're always checking, making sure that it is perfect, it is straight, it is just right. That's another category. Some people just have this intrusive thought. You just feel that you just have this continuous bad thoughts, and you have to keep saying the right thing. Maybe you are thinking, I don't want to say something bad now, but you keep having these maybe aggressive or sexual thoughts, and you keep trying to suppress them, by maybe thinking good things. That's another form of, compulsion. Some just have doubts about safety. So that's another one. So concerns about safety is another category. Some even have concerns about throwing away things. So you feel that, oh, I can't discard this paper. I have to keep it. It might be valuable. So they keep hoarding things. They keep hoarding. So that's another category. Some just have this this urge to pick the skin. You just feel like picking your skin. And, you are just picking. So that's another category. So we have different categories of OCD. So you have this obsession, and you also have the compulsive behavior that goes with it. So those are the different categories of OCD.
That's interesting. I mean, I didn't even imagine that hoarding could be a category of OCD.
Disorder.
Okay, Dr. Olabode, what treatments are available for OCD?
Okay, so about treatments can be non-pharmacological, that's without drugs, plus or minus drugs.
Okay.
So psychological treatment is without drugs. So we say patient needs to go for psychotherapy. And what I mean is that there are different types. We say exposure therapy. So what is done is that you expose the patient to the obsession.
Okay.
Okay, so you expose that person, but you prevent them from carrying out the compulsive behavior.
Oh.
So you feel that, your hands are dirty. Okay, so yes, they are dirty, don't wash them. So you want to prove to the patient that if you don't wash, nothing bad will happen to you.
Okay.
So you keep doing this over time until they get over that anxiety. Then another one is cognitive behavioral therapy. That one is you keep talking to the patient, like you're trying to change the patient's mindset, trying to change the patient's perception of that obsession. So these are done by clinical psychologists. When it is diagnosed and we refer it to them, it will be done. Then also medication. I talked about serotonin, some neurotransmitters in the brain. So we give medication to address this. And most patients, they feel better after some time. Although OCD can run a long, a chronic thing, it can be a long-term condition. But with treatment, some patients actually get better.
So I was going to ask, people who live with OCD, do they pose any danger to themselves or to people around them? And then how can they cope with all of this?
Oh, yes. Well, there can be some complications that can arise from OCD.
Okay.
I've talked about fear of contamination. So if somebody keeps washing the hands, you can imagine washing your hands like 12 times a day. I remembered when COVID came and we had to sanitize our hands over and over. After some time, I developed dryness of my palms and peeling of my palms. So yes, some of them develop some skin conditions. We say contact dermatitis. Because you can't keep washing your hands like a million times a day without, your skin becoming irritated. So they can have that. Then they also waste time. They spend excessive time on these rituals. So you can imagine someone has walked from the house. Let's say you live in a story, maybe like a 4 or 5 story building. You come down to your car to drive out, and you feel that you didn't lock your door, and you keep going back to check. So they waste a lot of time on ritualistic, on the compulsion. Then at times they find it difficult to cope at work, even in school, or even socializing with people. They find it difficult. So that can be stressful. Relationships can be troubled. If you are a perfectionist and your husband is not, or your spouse is not, and you keep getting up, of course the person sleeping beside you will keep waking up because you won't allow the person to sleep. So it can result in, troubled relationships. The quality of life of the individual is also not good because you can't get adequate sleep, you can't get adequate rest, you are always worried. So those are the, issues that can arise from OCD. Then how to cope? The first thing is, once you see that, this is giving me a lot of distress, you need to see a doctor. That's the first thing.
Yeah. Thank you.
Seek treatment. Then also family support is also very important. If you understand what your friend or your sister or your child has, you'll be able to help the person. You'll be able to offer support. So the person will be able to cope better.
Thank you very much, Dr. Olufunke. Thank you for joining us this morning. We've been able to learn one or two things on OCD, and hopefully our viewers out there have been able to, pick up something on how to make do when they realize that they may have OCD. Do enjoy your day.
Thank you.
Thank you. All right, so now we know that, we've said it before and then we're still going to say it again. You need a professional to diagnose you of this, and you can actually cope. That's something you can cope if you find somebody that can help you and also have a support system. Understanding is a big thing.
Honestly,
Understanding is a big thing in this conversation.
Honestly.
Especially, I liked that she mentioned conversations in relationships and with your spouse or whomever. Relationships can be troubled if you have a partner that has an obsession for something. Imagine you have to get to an interview, your partner is driving you, you live in a story building, the person is worried that they've not locked the door, they go 5 times to check here and there, you are late, or you have to wash your hands several times, or you have to be the one doing all the cleaning. In fact, you get tired and you get stressed. But so many things can help you be better and manage a stress level when you see a professional and also get the medications that are necessary. Please do not self-diagnose, do not self-medicate or do any of those things. Oh, you've heard it now that, you can do this, and then you've decided that you want to go ahead and take these drugs on your own. Some of these medicines are very strong. They're very strong. You shouldn't do that on your own. But you can cope. You really can.
The angle of understanding that got me was, and it's premised on the fact that if you have OCD or you see that you have a compulsion or an obsession that makes you just keep repeating that same action or you have to do something in a certain pattern or else you are going to have a bad day, you need to see a doctor. But beyond that, the day you realize that you have OCD, you should also at that point start learning to pull it together, because understanding is subjective. If we say understanding goes a long way, for some people it's too much pressure, because at the end of the day your spouse might be looking at, even me, I have my own, so why? You understand? So it will take so much. It will take probably couples therapy or the person going to therapy with you just so that they can understand what to do when you get like that. And it's a lot. It's a whole lot.
It's a whole lot. However, we love you, and this is one of the reasons why we bring these conversations on tea or coffee. So if you have any of these things, please run along to see your physician. We are begging and advising that you do so.